Eric Shaver, Doctor of Osteopathic Medicine, reaching out with another medical research update. Today, I want to talk a little bit about antidepressants and the risk for neurodevelopmental disorders, specifically autism spectrum disorder and ADHD. This is something that has been discussed by the current administration and the Department of Health and Human Services as being potentially a causative thing. And we have recognized the need for a little bit more research to evaluate it. Well, a large meta-analysis just dropped in Lancet Psychiatry that evaluated exactly this question. What they found was interesting. While they did find a modest risk increase with prenatal exposure to antidepressants and these two disorders, that modest risk went away when control for things like mental health, status of the mother prior to pregnancy, genetic risks, and other known risk factors for autism spectrum disorder and ADHD. Basically, what this study found was there is an increased risk for autism spectrum disorder and ADHD associated with mental health diagnoses. This probably does indicate a genetic link between the causation of some of these mental health issues and neurodevelopmental disorders in children. The other interesting thing was we saw that in women who had never taken antidepressants prior to becoming pregnant and then began to take them after a mental health diagnosis after the delivery of their child, we saw the same increase in autism and ADHD in their children. This really is a strong indicator that the link is purely genetic and has nothing to do with actually taking antidepressants. Well, I'm going to go ahead and put a link to that study in the description to this video. You can go and check it out for yourself if you're interested, and I will keep more coming as information becomes available. Hope this is helpful, and I will talk to you again next time.